Again, only insoles not gonna help because Indian culture is not that they use all the time the shoes. So again, and we always think only the while playing they require a no. Day to day what we doing, walking and everything, that is also counts a lot. That also, there's a one thing is flat feet, what congenital we get. Other one, based on that our activity and everything day to day, our weight loss, weight gain, everything impacts the way sit, stand and everything that impacts. And our feet goes in pronation or supination based on the offloading everything in day-to-day practice. So for that reason also we need to be take care of all this. So that helps in each and every patient. We get different kind of this data, and that helps us to plan their exercises. This for the flat feet. Again, this person is not engaging the toes at all, hardly. And this, almost everybody has this kind of behavior pattern, but we don't have any pain in the toes, we never realize it. So if somebody comes in the back pain and neck pain also, we have to look for the feet. Based on that, helps us to be. If I tell the patient this is pronation, supination, they're not gonna believe and understand. Kis chidiya ka naam hai ye? So I always give the data, then they do the R&D, they cross-check with their other doctors whomsoever they're visiting. So even other doctors are saying, okay, something with the data, then it's easy for them to understand. They don't keep giving us call. Otherwise, if they keep giving us call, okay, why I have done so and so, why you cross-check? So that helps a lot to be patient to be get recovery. Foot analysis and biomechanics again. Usually, perform the clinical practice. I suggest everyone to practice this one. This helps to get the better outcome of the patient. And even for the arthritis and all also, whoever do not want to go for surgery for their personal reason, anything. So I try to correct their arches, and that helps to control the pain. So this at least then something easy they try to find out. I give them something jugaad and they proceed with that. Joint interactions, definitely we know all if anything with the pelvic movement or anything correlate with the feet, base majboot hoga, then everything works. So similarly, we say feet is very much of important aspect, which whole study we have ignored. And I bought it in much later because of I was practicing in sports. Then I realized, no, why is not something getting resolved? So I should look for something where what is the root cause, and then I try to figure it out this one. This is helping better way. Similarly, all the anatomical location, everything, foot, all these thing, angles we get to know here. A step test, we do the 5 tests over there. So step test we follow. And this is the sensor plate, what we use it over there and connects with the wire. And this is even in the offline, we can take this to the on-field also. We don't need the Wi-Fi and all these things all the time over there. So this is easy to handle. We do take this one for all the marathon events and all, we get the better data. And then later on we can email them their reports and explain them. So we do all these things sometimes online also if they cannot visit our clinic. Otherwise we prefer to be have offline if they need further treatments. Or else it's easy to go ahead. Types of step test, there is a bipedal, foot pressure, stabilitometry, dynamic. So we categorize all these tests for whom all we require. Bipedal is almost for everyone we do, all the static one. Stabilitometry, whoever has little bit of balance issue and everything we do. Dynamic test, all the athletes and runner who is actively participating in some game or some event is there. For them we try to have target that test. These are for the events when we have taken all these things. This kind of reports we get, so this tells us the maximum pressure. You can see the difference. And again, the third one, the weight distribution in percentage. So all these things helps the patient also when they see anything in numbers, that gives the better understanding for them. And then they go at trust, why they have to do these exercises, why this is important. Or else they also say this is almost same hi to hai, itne time se hum kar hi rahe, kuch nahi hota isse. When I tell them, customize it, then they start working on that, and that helps them better way. Again, this is more of the hind fit person is engaging. So again, the weight, maximum pressure is the different, and the weight distribution also matters. So all these differences we can figure it out in this assessment. That helps a lot to be even geriatric care to handle, even the athlete category and the static one. So this is the more of prevention to the curative to the rehabilitative. All the categories we can engage this one. And either is the musculoskeletal conditions, either sports, either postnatal, anything we can engage with all these conditions. These are the major injuries that happen, and the sports people we know, they want to proceed the career in that game, same game continuously. But most of the time it has happened, their injuries has stopped them after a certain time and they could not proceed longer. So that's what definitely if we can work on, we'll have the next Olympic might will have the more number of the gold medals.